Yes.
Okay, let's begin this session. Come into the sitting posture. Close your eyes. Go into your asana. Observe the alignment. Take the moment for a few seconds to sit, to go into your posture. Now, once you connected with your asana, move your attention towards your natural breath. The breath which is going in and coming out. Just observe. Now, inhale from the belly, exhale from the belly. Now inhale for the 3-time Om along with Shanti. Take a deep, prolonged breath for the Om. Shanti, Shanti, Shanti. Feel the vibration and sensation. Join your both palm, rub your palm, place on your eyes. Very slowly while blinking, looking at your palm, gently open up your eyes with a great smile and say, Om Shanti, Om Shanti. Welcome to the therapy class. Till now, we discuss about the kapha related issues, the pitta related issues, the pitta problems, stomach and gastrointestinal problems. We are talking about these. So anybody who has constipation, indigestion, or psychosomatic disease, that is IBS, irritable bowel syndrome, which is very common. And if you feel hyperacidic and you burp a lot, you fart a lot, it shows that it is the indigestion. Those people who have lots of gas in their body, like air element in their body, they oftenly complain about bloating issues. They fart a lot, they burp a lot. After eating, they feel heaviness. These are the common symptoms, and which is very much, I think most of the people are suffering from these things. So indigestion. Now this, because as I keep talking about that, these digestive systems are the most important part of your body, because the whole food is prepared for the rest of the body. And we learn that if kitchen is not working, so whole home would be collapsed, because your whole body is made of the food. and it has to be proper assimilated, has to be proper absorbed, and properly, break down. If any one organ is not functioning properly, the rest of the organs would be affected by that. So if anybody has any tiny symptoms, they have to follow the diet which I discussed in the previous session. Now, asana, we talked about it, that all the things which is related with your abdominal region, core-related issues, how if you strengthen these areas, your organs would be strengthened along with it. But I'm not talking about here making the abs, like people are tightening their stomach. We are not discussing about that thing. We are just talking about when you activate the core muscles, it doesn't mean that you have flat belly. Okay, please don't understand shaping the body. It just you engage those muscles. When you engage those muscles, you're activating your organs, which is located there, and blood circulation is increased. Even people who does not have flat belly or tight belly, still they, all the blood circulation would be increased. That advanced level of core practice we are not talking about here. Okay. So, and we discuss about the asanas related to that. Now, apart from the asanas, there's a one very, effective asana which activate your digestive systems, especially the pancreatic system, your liver, and your bile, gallbladder. The function would be improved. That is a mandukasana. I'll write it down for you. You can ask to your asana teacher to learn that asana, or simply manduka asana. Manduka asana. Okay, this asana is very much effective, and the pronunciation manduka asana. So I'll just briefly give you how you have to. You have to sit in the thunderbolt posture, and then using the fist of both hand and pressing around your navel, and then you are doing the forward bending. That's how the manduka asana look like. But you can learn this asana in your asana from your asana teacher. Okay, and this practice, if you do, and it required the hold. So hold this asana for minimum 10 seconds, and then slowly, gradually you increase. So you can start counting 1, 2, 3 like this, and then slowly come back. So this asana is very much effective, especially even for the diabetic. If you have the diabetic, even aggravated condition, this mandukasana is very, very helpful. Another asana, which is very much important, because when we talked about the digestion related issues, and these hormones play very crucial role. So in that sense, activating the pituitary glands, which is located in your two finger up from your eyebrows, in between the space between the eyebrows. Okay. So pituitary gland, if you activate, how you're going to activate pituitary gland, and how you can control your hormonal imbalance. That's simple, meditation. If you introduce simple practice, anapan even, or any mantra chanting, or any practice, whatever you like. There's a tremendous method of the meditation. Whatever meditation you like, you can practice it. That's work on your pituitary glands and hypothalamus gland, which uh, which is the father of your gland, pituitary gland, if that working efficiently, rest of the glands automatically function proper way. And then even problems related to the PCOD or irregular periods or any, menstruation related issues, indigestion, or you get other issues, it would be helping when you do this practice. Then eventually you come out, you're balancing your hormones, because understand hormones play very crucial role for everything, whatever you're doing. You getting into the stress, as I talked about it, especially the IBS case, irritable bowel syndrome. It is a psychosomatic issue, and which mostly happen due to the stress level. And people who are having the stress, anxiety, frustration, depression, they often have these IBS symptoms, and that there's no cure. Doesn't matter what you see this, take the help of the doctors, but they cannot treat it. So to release the stress, you have to do the those asana which uh, balancing your pituitary glands. And another inversion posture you can introduce. Inversion posture, start with the semi inversion posture. Semi inversion posture, if you're practicing, blood circulation increase in your stomach, increase towards your heart, and increase towards your brain. But yes, understand those who are having hypertension, high blood pressure, vascular issues, they should not be practicing the advanced level of the full inversion, but semi-inversion, light inversion, where you have to just raise your 1 feet in supine posture, like you go into the supine posture and raising your feet at 60 angle, then 90 angle. Okay, that we called ardhalasan. I'll write it down name for you, and you can ask to your teacher or you can Google it. Half flow pose. In English, we call half flow pose. Okay, so or resting your feet against the wall. That is a variation. You just go into the supine posture and keep your feet uh, in the vertical level, and just rest your feet against the wall and hold this posture 5 to 10 minutes. And when you're holding, do the abdominal breathing lot. I keep talking about abdominal breathing work wonder, very effective. Okay, so um, yes, all the inversion should be and mandukasana should be practiced fully empty stomach. So morning time considered to be a best. Evening time still you can practice, but make sure 5 hours you haven't eaten anything. Then this asanas work as a miraculous way. Miraculous way. Okay, only these two asanas they are practicing, their digestive system, all the digestive organs work in efficient way. And yes, along with the abdominal breathing in half flow pose, mandukasana, holding that posture for 10 seconds, and that time normal breathing you can practice. So this is the two most important asana. You have to, whenever you make the sequence of the core practice, include these asana into your practice. It's mandatory. Now, other things apart from Shatkarma, I talked about it already. Now, breathing practice. What breathing practice? They can go with it. Now, I talked about 4 safe practice. Okay, that is thoracic breathing, abdominal breathing, then your yogic breathing, and then your nadi shodhan. These 4 should be, practice 15 minutes. But along with it, these are the 4 practice. Everybody should practice it. Okay. And whenever you give the group classes, so you don't have much time to introduce the particular kind of take caring the particular kind of disease. So these 4 practice gonna save you. you can make the sequence, and then it's gonna work for all the diseases, all the problems. Any students which is participating in your class, they also, get the benefit of it. So these 4 practice always include in your session. Now, along with it, Kapalbhati is very effective. Kapalbhati. Okay, Kapalbhati. This Kapalbhati has to be done very slow pace. Slow pace, not fast one. And along with Vayu Mudra, I've shown you Vayu Mudra. You can learn also through your pranayam teacher, Vayu Mudra. It's very simple. I'll just explain. It's roll your index finger and tuck with your base of the thumb. That is the Vayu Mudra. Very simple mudra. I have already shown you. I've taught this in the previous session. So if you miss it out, you can see the previous video even. So Vayu Mudra along with the Kapalbhati, one should practice. It increase blood circulation around your abdominal part, and it's also tone the muscles around this. And if these muscles are toned and your organs are get high blood circulation, these area, work in efficient way. And so digestion, assimilation, proper absorption gonna happen. So Kapalbhati has tremendous benefit, but it has to be done. You have to, whenever you introduce, you require lots of precaution. Okay, understand. Kapalbhati has precaution, and this is the part of the Shatkarma, which you learn in the pranayam class. But again, I'm saying before introducing, check that nobody has any problem in your class, especially the back lower lumbar region, or they do not have ulcer, peptic ulcer, hernia, hemorrhoid, or constipation. If they have constipation, you cannot practice Kapalbhati. Menstruation during the pregnancy. Okay, any surgery, recent surgery, they go through it, and high blood pressure, and yes, stroke if they have these. During these times, Kapalbhati should not be practiced by in these symptoms. Whenever they have these any of one symptoms or all the symptoms, it is a dangerous practice. So please, it is my humble request. Do not, it's become very much fashion. People do go with the fast pace of the Kapalbhati, and they do not even practice. They don't know how to practice the proper Kapalbhati. Okay, so it is a dangerous practice. Learn properly. If you have any doubt about it, don't introduce and even don't practice. But slow pace of the practice is safe version, safer than the other. Actually the fast version of the Kapalbhati. The actual version of the Kapalbhati has to be done in the fast version. But 2 months, 3 months, you have to allow your body to accept the fast version of the Kapalbhati. Many yogis who show the Kapalbhati to you, they practice many years. So their body become habitual for that fast movement. Okay, so many teachers, they forget, I don't know, they maybe forget about it, but most of the practice, especially which is related with the pranayam, and this is required lots of precaution. So Kapalbhati, but yes, it has tremendous benefit. It's work on lowering down your stress level. It's improve your memory. It's provide you the natural glow. It's purify your blood level. So pitta, which, and yes, it is heat in nature. So if pitta is aggravated, they shouldn't be practicing the Kapalbhati. Okay. So, but yes, it's also improve the digestion. It's improve uh, your assimilation of the food, and yes, it's purify your the tissues. Deeper level of the tissues get purified by practicing the Kapalbhati. And yes, psychosomatic problems or psychological problems, Kapalbhati work wonder. If you practicing, when you practice, just observe. This is a task for you guys. When you practice the Kapalbhati, see yourself, see your mind. Mind is more focused because that time your mind is not able to lost in the thought. So it's very effective method. I have observed. You can just this is a task. This is an experiment for you. Do the practice of Kapalbhati morning time and just observe your mind. And especially when you do practice the fast version, your mind cannot think anything else. So now, so this is the Shatkarma practice, but modern yogis put into the pranayam practice as well. So it's come into the both. It considered to be Shatkarma and pranayam. Now, apart from the Kapalbhati, Brahmari pranayam, because many people they have stress, so Brahmari pranayam work amazing. So Brahmari pranayam, one should practice how long? 10 to 15 minutes. And these are all the variation of the Brahmari pranayam. Any one of the variation you can choose and practice the Brahmari. Along after practicing the Kapalbhati, you can practice the Brahmari pranayam. That's also can be. You can start your sequence with Kapalbhati and Brahmari, and you can end your class with these two. It's totally your call. Or two times you can start your class or end your class. That also you can do. It's totally your call. Um, Apart from the Brahmari pranayam, then in meditation, what meditation you can introduce to them? Makar chanting. I'll write it down for you. It's Pranav meditation. Pranav meditation, whole Pranav meditation work wonder. Pranav, okay. The Om chanting. In this Makar chanting, Pranav, there is a division. So Makar chanting is the part of Pranav. Pranav is Om. I'm chanting U, Ma, Akkar, Ukkar. When you chant A sound, we call Akkar chanting. When you chant U sound, we call Ukkar chanting. And Pranav, the Ma sound, Makkar chanting. This is my personal observation. Though the whole Om chanting, each and every syllable of the Pranav is very much effective, but Makar, Ma sound, it has a strong vibration. Even you can just see by yourself. Mm, just close your mouth and chant. And you see your whole above the throat area and this whole area immediately feel the vibration. Very strong vibration immediately you felt. And that is the most important part. When any tool which just immediately control your senses, then immediately your stress level go down. And Makar chanting increase the delta alpha waves of your brain, which show the that your mind is pacified, your mind is peaceful. So whenever the doctor check the quality of the mind, that that person is peaceful or not, they check the waves. We have alpha, beta, and gamma and delta waves in our brain. Through that waves, we check somebody's peaceful state of the mind. So delta waves are very effective waves, which shows delta waves increase even so, which show the peaceful state of the mind. So makar chanting when one person is practicing, and how long? More you practice, more you would becoming calmer. So if you practice for long time, start minimum 15 minutes, and extend as much as you want. If you feel comfortable, if you get tired, just go relax and chant within your mind. That is very effective tool. And makar chanting, as I keep talking about these, the psychosomatic issues and especially the gastrointestinal problems, you cannot exclude the meditation. People think we take the herbs, we eat properly, but they forget about to bring their stress down. If they're not working on their stress level, problems remain in their body, and then the stress is the pressure, the pressure, wrong pressure to each and every cell. I'm not talking about the organs. Each and every cells are working in the tremendous pressure, and so problems would not become out. Temporary, it would be relief, but meditation is the most important part of the therapy. Never ever exclude the meditation part. Choose the method, is totally your calls. If your student or your does not feel comfortable with makar chanting, okay, they cannot sit, okay, give them the dancing, walking meditation, or any other simple meditation which they love, or listening the music or the sound, or they just love to observe the nature. So just try to use any method, but give them initial help. But yes, makar chanting is more effective method for them. So this is the meditation part. Now, even other issues, if they're facing it, I'm just adding the few herbs. So anyone who has issues, and if they start taking these herbs, it's very much good for them. So please write it down, which improve their digestion, especially for the constipation. Triphala churn, aggravate condition of the constipation. Triphala churn, this is the powder which is made of the three fruits. Okay, we have is a mixture of the three herbs, and that triphala is very much good for improving the digestion, and even it's rich in the fiber, vitamin C, other minerals, which flush it out your mala, your waste from the body. How one has to take before sleep, you can use lukewarm or hot water. Take 1 teaspoon the triphala churn, take it and sip the water. Okay. And if condition is so much aggravated, take twice a day before sleeping and after Ushapan Kriya. Once you go with drink the copper water, then take the triphala churn in the morning time. Clear? So after the Ushapan Kriya, triphala churn, empty stomach should be given, and at least 1 week. 1 to 15 days they can take, but then after that they have to stop. Do not just rely on the churn to clean your stomach. Okay, it's just for temporary. If condition is worse, and it is a safe, it's a safe powder. Even you can slowly, gradually reduce this amount. But once you flush it out everything, then work on your diet, do the practice, then you would not be dependent on this herbs. But for 15 days, for minimum 1 week, maximum 15 days, even sometimes the people who have very, very weak digestion and they oftenly have constipation, like years, many years they have constipation. For that, we give 1 month, 48 days treatment. 48 days, we give the herbs of Triphala children. And then also, but that extreme level, only the observation under the guidance of the yoga therapist and the doctor. Why we cannot extend? So body would not be dependent on to what happened when you take the herbs, your body start depending on that. So we require to break time. So when we prolong the treatment, like 4 months if we want to give, so we give the break in between. So it's totally the call of the doctor. Doctor gonna observe or the yoga therapist gonna observe. Like when I give, I observe the patient. So Triphala should be 15 days is the safe version. Okay. So you can take it. It's very good for your eyes, good for your brain, releasing the stress. Again, Triflachurin, after Triflachurin, if you are not vegan, cow desi ghee is work wonder for improving the blood circulation. But many people's, they cannot take the cow. I keep talking about, so what they can do. Dates for quick instant relief. Dates. So dates should be given at least 12 to 15 dates. So you can, the ripened dates, okay? And that dates you can take early morning, empty stomach, after your Ushapan Kriya. Then what you need to do, take the hot water, keep ready the hot water, and eat the dates, 12 to 15 dates. Slowly, chew properly. It's rich in fiber, rich in everything. And then drink the hot water, sip it the hot water. It immediately give you flush. It give you the diarrhea immediately. And so if you have, like, I met the many people, 1 week, they are not going for loo and they complain about it. They feel heaviness and other things. So this is the instant relief. Only once, if condition is so aggravated, then you have to take it. Otherwise, don't go for it. Okay. You can just take the Triflachuran, that's also effective. Both practice you can mix also. Trifla you can take during the night. Morning time, you wake up. After Ushapan Kriya, take the dates. And 12 to 15 dates. And immediately you rush for the toilet. And it flush it out everything. People who get the hemorrhoid, like the skin is come out with the constant, is like very the worst condition. The whole anal part is swollen and the skin is also come out because too much pressure on your anal region. In this condition, what we can do? So for that, in Ayurveda, we have Virechan Kriya, Anima, which I talked about it. But in Yoga, we have Basti Kriya. Write it down for you. This Basti Kriya is like you are sucking the water through your anal. It's like an anima and in yoga practice. And then you feel the pressure and you flush out. Second, Mool Shodhan Kriya. Mool Shodhana Kriya. Here, this Kriya you can do at your home as well. Or we Ganesh Kriya. It's a little bit yucky, and please don't laugh about it. But for the people who have hemorrhoid and they're suffering from that and they have to go for the surgery, it's bring instant relief for them. Okay. Indigestion, indigestion is like your costal, your intestinal muscles are weak, but in constipation, constant, it's like mind is completely, in that area. Anal region, mind reach, just going towards the stomach and anal region. So much pain, they cannot sit even. In this situation, you have to take the raw turmeric root, okay, and put into the mustard oil. It will give you the burning sensation. And sesame oil also you can use, but mustard and sesame oil, mustard, I have the experiment with the mustard oil, and the result is amazing. So mustard oil, you put that root of the turmeric. It has to be organic. Put into the turmeric and find the, like a middle finger kind of turmeric root. Okay. And put into your anal region and rotate it, go put inside and take it outside. So the anal walls, which are inflamed due to the pressure of the mala, your poo, your stool, and which the skin is cut it out. It get the lotion. It's work as a lotion. Anti-inflammatory creams you use, many people use whenever they get the hemorrhoid. Okay, soothing creams, steroid even they put it there. But instead of that, you can use this treatment. Little bit you get the itching and you get the little bit burning, but it's fine. And how many times, 2 or 3 times you can do this thing and give the massage to that area, the hole would be gonna open. It's because it's gonna be closed. So that hole gonna be open slowly and gradually. And any bacteria is located there, or the wound is, or it started bleeding or something like that happening, it would be taken care by that Mula Shodhana Kriya. It's very much effective. And if you don't get these things, you can use your finger, second best option. Dip your finger, middle finger in your mustard oil and put inside your anal region, up and down, circle motion, anti-circle motion, at least 1 minute, do the massage. And after taking the bath, always apply the oil like this. So it get the moist. Okay, the moisturizer is there. So it would not be inflamed and not gonna bleed. So this is the all about the problems, psychosomatic, constipation, indigestion, and these tricks very much helpful if they practice. Uh, I think mostly they don't require the surgery then. So um, this is all about. Any question, any doubts till now related to this?
Thank you.
Okay, lovely. No questions. So
One quick question. Last time you said there are 4 meditative poses. Four breathing things, but you only mentioned Kapalbhati. What is the other 4?
dear, I keep talking about it. That 4 breathing, which is very first class I talked about, that is your first breathing, abdominal breathing, then your thoracic breathing. Okay, that 4. It's safe for everyone. So don't always include the 4.
Thoracic,
And yogic breathing and nadi shodhan. Okay,
that's
these
more than
4 practice.
I mean, yogic breathing, Nadi Shodhan, Kapalbhati, and one more.
No. Kapalbhati is the special case. And I talked about it. It required lots of precaution. Okay. So when you introduce the Kapalbhati to your class, it's work wonder. It has the tremendous benefit, but understand it required lots of precaution. So if you have doubt, this 4 practice, which I keep talking about it, that anybody can practice, that is a safe version. If you have doubts like one of the students might have certain issues or high blood pressure, maybe pregnant ladies joining your class, or menstruation time, somebody's come to your class.
Okay.
So in that time, you shouldn't be introducing the Kapalbhati. Kapalbhati would be specific reason, okay? That's, I talked about it. 4, abdominal breathing, thoracic breathing, yogic breathing, and Nadi Shodhan. Anybody can practice. This is a safe practice. Clear? Oh, okay. So tomorrow course is almost finished. So tomorrow we're gonna have the question answer session. So question answer session. If you have any doubt, any questions or any disease related questions you want to ask, so tomorrow we have class for question answer round. Okay. So thank you. Om Shanti. Bless you. Bye bye. Take care.
Enjoy your day.